Have you ever stopped to think that your sleeping position could be seriously affecting your health, and you might not even realize it? Sleep is vital for restoring your body, balancing hormones, and strengthening your immune system. However, if you adopt an inadequate sleeping posture, especially in old age, you may be accelerating spinal wear, interfering with heart function, hindering breathing, and even impairing brain performance. Research shows that sleeping in an incorrect position is associated with conditions such as respiratory disorders, reflux, persistent joint pain, memory lapses, and circulation problems, conditions that affect millions of people over 60 every year. The most alarming thing? Many of these people don't even realize they're sleeping incorrectly. My name is Dr. William Tharnell. I'm a physician specializing in senior health care, with over 25 years of experience in geriatrics and integrative medicine. In this video, I share an essential reminder: the positions to avoid while sleeping after age 60, and the nighttime habits that can protect your body while you rest. If you're looking to live a quality life, avoid serious illnesses, and want to age with autonomy and well-being, then this content is for you. Share this video with your friends and family. Like and subscribe to receive more science-based health content, especially created for those over 60. Let's get straight to the point. As the years pass, the body undergoes several transformations. Bone mass tends to decrease, muscles lose strength, joints become more sensitive, and blood flow can become less efficient. What once seemed like a mild discomfort upon waking can, over time, turn into persistent pain or even pose a serious health risk. After 60, sleeping poorly, or in an unfavorable position, doesn't just mean waking up with a stiff neck or back. It also hinders cellular recovery, strains the cardiovascular system, limits cerebral oxygenation, and aggravates pre-existing conditions such as arthritis, osteoporosis, or high blood pressure. Studies from the Journal of Clinical Sleep Medicine confirm that older people who sleep inadequately have higher rates of lower back pain, respiratory and digestive disorders, and intense fatigue throughout the day. Another relevant concern is that nighttime posture can affect the brain's natural cleansing process, a process known as cerebral lymphatic drainage, which occurs during deep sleep and helps remove toxic waste that may be associated with Alzheimer's and other neurodegenerative diseases. Understanding the correct way to sleep after 60 isn't a luxury, it's a physiological necessity to keep your body and mind functioning. And most interestingly, small adjustments can already generate significant changes. Among all the sleeping positions, one stands out negatively for those over 60, sleeping face down, also called the prone position. This is undoubtedly the most detrimental to spinal alignment, proper breathing, and brain activity. And worst of all, many still believe this position is comfortable, out of sheer routine. When sleeping on your stomach, your neck is forced to one side for long periods. This causes compression on the neck vertebrae, misaligns the spine, and can compromise cerebral blood flow. For older adults, this prolonged twisting can cause neck pain, numbness in the arms, and even dizziness upon waking. Furthermore, this sleeping position prevents the lungs from expanding effectively, making it difficult to breathe at night, which poses a high risk for those already living with respiratory conditions like emphysema or asthma. What's more, by putting pressure on the abdomen, this position can worsen gastric reflux and even promote the development of abdominal hernias. In more critical situations, such as those with osteoarthritis of the spine, this sleeping position can cause ongoing joint inflammation, compromising rest and mobility. Tom, a 68-year-old patient, had slept on his stomach since he was young. However, after experiencing numbness in his fingers and neck pain in the morning, he decided to change his sleeping position. Today, using a more appropriate posture, he reports more restful nights and waking up without discomfort. The prone position may seem harmless, but for people over 60, the damage it causes is profound and often permanent. When lying down, the spine should maintain its physiological curvature, with alignment between the neck, back, and hips. But many sleeping postures disrupt this balance, creating pressure that builds up over the night. This type of misalignment is one of the main factors behind the chronic pain that affects so many older adults. It's silent, gradual, and often neglected, until the discomfort becomes unbearable. When the pillow isn't appropriate, for example, the head may be too high or too low, putting strain on the neck. This compromises the discs between the vertebrae, which become more fragile with age, accelerating joint wear. Similarly, if the lower back isn't well supported, it receives excessive pressure, contributing to problems such as herniated discs or nerve inflammation. Research from the American Academy of Sleep Medicine indicates that postural misalignment during sleep is among the most common causes of morning pain in older adults. And most worryingly, most people don't realize the problem stems from the way they sleep. Jane, 72, spent years treating her back pain without success. It was only after adjusting her sleeping position with a suitable pillow and support between her knees that she began to experience significant relief. Realigning your spine's posture during sleep isn't just a matter of comfort. It's essential for maintaining mobility and preserving quality of life in later life. The way we sleep directly impacts heart health and lung capacity, especially after 60, when these functions are no longer as resilient. Postures that compress the chest, such as sleeping on your side without support or on your stomach, hinder lung expansion. This reduces oxygen intake into the lungs and, consequently, into the blood. In response, the heart has to work harder to ensure adequate oxygenation. This additional effort can cause increased blood pressure during sleep, which is quite risky for those who already have hypertension or a history of heart failure. In the elderly, any difficulty breathing during sleep can cause brief awakenings, fatigue upon waking, palpitations, or arrhythmias. Data from the European Respiratory Journal reveals that inadequate sleep is linked to the risk of nocturnal cardiovascular events in older adults. Pulmonary congestion also tends to worsen in cases of mild heart failure due to fluid retention in the airways, which occurs more frequently in unfavorable positions. Mark, 74, began waking up short of breath in the middle of the night. After medical advice, he began sleeping with his torso slightly elevated and turned to his left side. In less than 15 days, he reported significant improvement in his breathing during the night. Breathing well while sleeping is one of the most powerful ways to preserve your heart and lungs, and it starts with your sleeping position. Did you know that the brain has an internal detoxification mechanism, and that it only works fully during sleep and when you adopt certain sleeping positions? This process is called the glymphatic system, whose main function is to remove toxic substances accumulated in the brain throughout the day. Among these substances is beta amyloid, a protein associated with the onset of Alzheimer's and other neurological diseases. What many people don't know is that the effectiveness of this system depends directly on how your body is positioned while you sleep. A study conducted at Stony Brook University in the United States showed that sleeping on your side, especially on your right side, significantly improves glymphatic drainage, while sleeping on your back or stomach impairs this process. After 60, the brain's ability to regenerate is no longer the same. Any factor that hinders the elimination of these toxins can have significant consequences, such as memory lapses, difficulty concentrating, and even a higher risk of diseases like dementia. Another problem is that sleeping on your back with your head too low can hinder venous circulation in the brain, which increases intracranial pressure and reduces cerebral oxygenation, a serious risk for those already experiencing cognitive decline. Helen, 70, was experiencing difficulties with memory and concentration. After adjusting her sleeping posture with an ergonomic pillow that kept her neck in the correct position, she began to notice significant improvements in her reasoning and mental alertness in the morning. Your brain needs care even while you rest. And it all starts with the right sleeping position. Acid reflux problems are very common among the elderly and tend to worsen considerably at night, especially when sleeping in an inadequate position. This occurs because, when lying down, gravity no longer acts to contain stomach contents. If a person is positioned on their back or on their right side, stomach acid rises more easily to the esophagus, causing symptoms such as heartburn, dry cough, a choking sensation, and even sores in the throat or vocal cords. Research published in the American Journal of Gastroenterology revealed that sleeping on the left side significantly reduces nocturnal reflux episodes, while sleeping on the right side exacerbates them. Furthermore, very soft mattresses or low pillows increase pressure in the abdomen, facilitating acid backflow. George, 67, reported a constant burning sensation and throat clearing upon waking. Following medical advice, he began sleeping with his upper body slightly elevated and always on his left side. Within a few days, his symptoms virtually disappeared. Inadequate sleep can turn the nighttime into a silent trigger for serious digestive damage. If you've ever experienced heartburn when lying down or woken with an acidic taste in your mouth, consider these signs to be clear warnings from your body. Adjusting your nighttime posture may be the simplest and most effective step toward protecting your digestive health. The relief you feel from proper sleep isn't just a sensation, it's physiology working in your favor. Snoring is often seen as a normal nuisance. But among people over 60, it can be a sign of something much more serious: sleep apnea. Apnea is a condition where breathing repeatedly stops and starts while sleeping, often without them realizing it. And one of the most common causes of this condition among older adults is linked to sleeping posture. When sleeping on your back, the throat muscles relax too much and the tongue can slide back, partially blocking the airway. This blockage reduces airflow, causes tissue vibration, the infamous snoring, and, in severe cases, completely stops breathing for several seconds, affecting the brain and heart. This repeated obstruction also puts pressure on the neck muscles and jaw joint, further exacerbating airway narrowing. The Sleep Foundation warns that untreated apnea is linked to increased blood pressure, heart attacks, strokes, and memory problems, especially in older adults. Sleeping on your side, preferably the left side, with your head well supported and your chin gently elevated, can significantly reduce episodes of mild to moderate apnea. This simple change can improve sleep quality and preserve the health of your nervous and cardiovascular systems. Albert, 73, was constantly tired, with memory lapses and uncontrolled blood pressure. By changing his sleeping position and adopting a pillow that prevented him from rolling over onto his back, he saw his symptoms subside. Breathing freely while sleeping may be one of the most important decisions for healthy aging. Have you ever woken up with tingling in your arms, numbness in your legs, or sharp pains in your hips during the night? These signs are clear indications that a nerve may be being pressed due to the way you're lying down. This is quite common after age 60. As we age, the tissues surrounding nerves, such as muscles and ligaments, lose elasticity and moisture. This makes nerves more vulnerable to compression, especially during the time the body remains immobile during sleep. Leaning on one shoulder, putting pressure on joints, or twisting the spine can compress peripheral nerves, resulting in burning, tingling, or shooting pain. The most affected areas are the arms, legs, neck, shoulders, and hips. This compression often occurs silently during the early morning hours, disrupting deep sleep and causing fatigue throughout the day. The notorious carpal tunnel syndrome, for example, can worsen if a person sleeps with their wrist bent. Sciatic nerve compression is another common example in people who sleep with their spine misaligned or on their side without support between the knees. Dorothy, 76, had frequent episodes of numbness in her left leg and pain radiating to her ankle. With small changes, such as using a pillow between her legs and an orthopedic mattress, the symptoms disappeared within a few days. Don't ignore these signs. Adjusting your sleeping position is a powerful way to avoid serious nerve problems and preserve your quality of life. The position of your face during sleep can have a direct impact not only on your appearance but also on your physical and emotional health. Resting your face directly on the pillow with constant pressure can compromise blood flow to the face, accentuating expression lines and even interfering with facial nerves, a greater risk in older adults, especially those with a history of vascular microproblems. Furthermore, when the head is tilted too far or the chin touches the chest, the space in the upper airways decreases. This promotes snoring, increases the likelihood of apnea, and impairs oxygenation to the brain, which can affect not only memory but also mood and cognitive performance throughout the following day. Studies from the Sleep Health Journal indicate that people over 60 who sleep with their face incorrectly positioned report symptoms such as headaches upon waking, dry mouth, irritated eyes, and a persistent feeling of fatigue, signs that are often underestimated or attributed to normal aging. Another important detail: old pillows or those made with inadequate materials can cause allergic reactions, itching, or even aggravate rosacea and dermatitis. Nancy, 70, suffered daily from watery eyes and a stuffy nose upon waking. Switching to a hypoallergenic pillow and adjusting the neck tilt eliminated the symptoms within a few days. The way your face rests at night can be a reflection of your health care. And small adjustments can make a real difference in your mood and well-being. During deep sleep, the body enters an intense regeneration mode. This is when tissues are repaired, the immune system is strengthened, and essential hormones, such as melatonin and growth hormones, are released. But if you sleep in an uncomfortable position, this cycle can be repeatedly interrupted without you even realizing it. The result? You wake up exhausted, achy, irritable, and with the nagging feeling that the night wasn't enough for rest. Incorrect positions cause micro-awakenings, brief interruptions in deep sleep, which, while not waking you fully, prevent the body from reaching the most restorative stages of rest. This disruption particularly affects the production of melatonin, which is responsible for regulating biological rhythms and influencing mood, appetite, and the immune system. Furthermore, when the body is in an uncomfortable position, the brain interprets it as a mild state of alert. This activates the sympathetic nervous system, which releases stress hormones like adrenaline and cortisol. Over time, this frequent activation during sleep can trigger insomnia, increased blood pressure, weight gain, and changes in blood sugar regulation, which is even more concerning for those living with prediabetes or type 2 diabetes. Bill, 69, suffered from constant morning fatigue and poor nights of sleep. After reevaluating his nighttime posture and adopting cervical support, in addition to slightly elevating his legs, he returned to having restful nights. The correct sleeping position doesn't just alleviate discomfort, it activates the body's deep recovery mechanisms. And this can transform your health in silent but powerful ways. Changing the way you sleep after decades of the same habit may seem challenging, but the good news is, it's never too late to start. Even simple adjustments, made carefully, can bring real benefits to your sleep and your body. The first step is to understand your dominant sleeping position. Many people believe they sleep on their side, but wake up on their stomach or back. Observing or being observed in the early hours of the night can bring this clarity. After that, comes the adaptation. Using strategic pillows, such as a support between the knees when sleeping on your side, helps maintain hip alignment and reduces pressure on the lower back. An ergonomic pillow supports the head and neck properly. And slightly elevating the torso benefits those with reflux or respiratory problems. Another important tip is to create a sort of physical barrier with pillows behind your back or at your sides, preventing you from involuntarily tossing and turning during the night. And remember, the most important thing is consistency, not perfection. The body takes time to adjust to new sensations and postures, especially during sleep when we're most vulnerable. Robert, at 71, thought it was impossible to change his sleeping style. With some simple guidelines, like changing his pillow and using a support between his legs, he felt a significant improvement in his lower back pain within 3 weeks and felt more energetic upon waking. Changing your nighttime habits after your 60s, 70s, or even 80s can be one of the smartest and most transformative decisions for your health. And your body will certainly thank you. After 60, choosing the ideal sleeping position should prioritize spinal alignment, fluid breathing, and good circulation. Fortunately, these postures are simple to adopt and have a huge impact on sleep quality. The most recommended is sleeping on your side, preferably on your left side. This position promotes blood circulation, relieves pressure on the heart, reduces reflux, and improves the brain's natural cleansing. Furthermore, it reduces snoring, combats mild cases of apnea, and reduces lower back pain. However, to achieve all these benefits, using the right support is essential. A pillow that keeps your head aligned with your torso is essential. Placing a pillow between your knees helps stabilize your hips and prevents uncomfortable twisting in your lower back. For those who have difficulty sleeping on their side, the second best option is to sleep on your back, with your torso slightly inclined and a support under your knees. This reduces the load on your spine and makes breathing easier. However, this position is not the best for those who suffer from loud snoring or sleep apnea. Sleeping on your stomach, as we saw throughout the video, should be avoided as much as possible. Barbara, 75, suffered from constant reflux and hip pain. By adopting the left side position and using a pillow between her legs, She began to sleep better and reduced her use of heartburn medications. There is no single perfect posture for everyone, but there are principles that ensure restorative sleep: a well-aligned spine, distributed body weight, supported joints, and clear airways. For the correct sleeping position to truly benefit, it needs to be combined with the right accessories, especially the pillow and mattress. When it comes to the pillow, the main rule is to keep the neck aligned with the rest of the spine. Seniors who sleep on their side should opt for a higher, firmer pillow that fills the space between the head and shoulder. Back sleepers should choose a medium-height model that supports the neck without projecting the head forward. Avoid pillows that sag easily or are too high. Opt for materials like memory foam, latex, or ergonomic models. As for the mattress, it needs to be firm to keep the spine aligned, but with a layer that reduces pressure on support points, such as the shoulders and hips. Avoid overly soft mattresses, which cause the body to sink and promote misalignment. Hybrid models, which offer support and comfort at the same time, are generally best for seniors. If possible, choose a mattress with zoning technology, which adapts support to each area of the body. Mary, 78, suffered from persistent shoulder pain. By switching to an orthopedic mattress and adjusting the pillow height, she slept soundly again after years of poor sleep. And finally, let's recap the main points from this video. Avoid sleeping on your stomach after age 60. Prioritize the left side position. Keep your spine, neck, and hips well aligned. Poor posture can affect your heart, brain, lungs, and nerves. Small changes can transform the way you sleep and live. You now have powerful knowledge in your hands. Understanding how nighttime posture directly impacts health is one of the most important steps to aging well. Sleeping well goes beyond rest. It's a profound care for your heart, mind, and longevity. If this content was helpful to you, click the like button, share it with your family and friends over 60, and subscribe to the channel to continue receiving reliable, science-based information aimed at a long, active, and quality life. Remember, sleep is a fundamental pillar of health, and how you lie down can be the best investment you make every day without costing you anything. Take care of your sleep. It can be your greatest ally for a more fulfilling life. I am the Dr. William Tharnell. It was an honor to accompany you this far. See you in the next video. And until then, take care of yourself, because no one else can live your life for you.